Good afternoon, everybody. My name is Dr. Lynn Klima, and I'm going to be your faculty for this course. We're going to be talking about OSHA bloodborne pathogens, prevention and response to exposure. QAPIplus or myself do not have any financial interest relationships or other potential conflicts with respect to the material which will be covered in this presentation. Just as a reminder, this course does not substitute for legal advice for any individual provider or situation. Always consult your company's legal or compliance personnel with any questions or concerns related to this subject matter. So like I said, my name is Dr. Lynn Klima. I'm a nurse practitioner who's been focused on adult health, primary care, and community based care, including hospice and home care and palliative care. I've also worked as a nursing faculty at the University of Olivet in Michigan, and I'm currently serving as the patient safety officer for QAPI Plus PSO. So, in our presentation today, we're going to be doing an overview of OSHA's bloodborne pathogen standards. We'll look at standard and universal precaution guidelines, and we'll discuss three of the most common bloodborne pathogens: HIV, hepatitis B, and hepatitis C. We'll talk about the pathogen transmission and risk. We'll also talk about sharp safety to minimize the risk of needle sticks and talk about a recommended best practice for sharps disposal plan, and we'll review exposure reporting. So one of the things to remember is and know is what OSHA's role and requirements are in terms of how healthcare organizations need to maintain a safe and healthy work environment for their employees. So, just as a recap, OSHA is the Occupational Safety and Health Administration, is a federal agency that's responsible for setting and enforcing workplace safety and health standards. OSHA has established specific standards and regulations for healthcare settings, covering areas such as bloodborne pathogens, personnel, protective equipment, and hazard communication. OSHA in healthcare plays a crucial role in ensuring the safety and well-being of healthcare workers, including all clinical staff, nurses, doctors, and support staff. And OSHA conducts inspections of healthcare facilities to ensure compliance with its standards and can issue citations and fines for violations. So the intention, as we're talking about this content today, is to think about safety for yourself, safety for your coworkers, and safety for our patients, and how that is addressed or guided in the organization that you work for. In home care and hospice, we think about the standards that are unique and specific to where we're working. So in that setting, bloodborne pathogen standards in those community-based settings or hospice facilities require employers to protect employees from exposure to blood and other potentially infectious materials and to provide training, personal protective equipment, and post-exposure evaluation and follow-up care. So that's a big piece of what we're going to go over today. Also, hazard communication standards. OSHA requires that our employers have a process to provide information and training to all their employees on the hazardous chemicals that they may be exposed to in the workplace and to maintain safety data sheets for those chemicals so that we're aware of those things that we come in contact with or potentially could come in contact with and what we need to do to protect ourselves from them. Respiratory protection standard. This requires employers to implement a respiratory protection program, including medical evaluations, fit testing, and training for employees who may be exposed to respiratory hazards. Occupational noise exposure standard. This establishes permissible noise exposure levels and requires employers to implement hearing conservation programs, including audiometric testing and the provision of hearing protection devices. And then ergonomic guidelines for nursing homes, providing guidance on addressing ergonomic hazards in nursing homes, including patient handling, repetitive tasks, and workplace designs. So you can see in the settings where we are, maybe not all of these things apply or are applicable, but OSHA has a really wide umbrella, right? And so what we're going to talk about today are we're going to focus on the bloodborne pathogen standards We're also going to talk about communication around standards and hazards that we might come in contact with. And then a few others you might have heard in other complementary trainings around respiratory protection and ergonomic guidelines, particularly it addresses here nursing home, but we also have those in our outpatient settings and patients' homes as well. So again, it's all related to the policy development, how it's communicated, how staff are trained on it, and what we need to do to protect ourselves and our patients from things that we might commonly come in contact with or be exposed to or actively engaged in as we care for our patients and the settings that we're caring for them in. All right, we're going to start off with a definition of bloodborne pathogens. So, bloodborne pathogens are pathogenic microorganisms that are present in human blood that can cause disease in humans. These pathogens can be transmitted through various means, including direct contact with infected blood or other potentially infectious materials. Otherwise, as we go through this presentation, will be labeled OPIM, such as certain body fluids. Bloodborne pathogens pose a significant risk, especially in healthcare settings and workplaces where exposure to blood is possible. So, we're going to go through a couple of common bloodborne pathogens that we might come in contact with in our roles. So, the first is HIV, or human immunodeficiency virus. HIV is a virus that attacks the immune system, specifically targeting and depleting the CD4 T cells, making individuals more vulnerable to infections and disease. Transmission occurs primarily through blood, sexual contact, and from mother to child during childbirth or breastfeeding. While there is currently no cure for HIV, antiretroviral therapy, ART, can manage the virus and prevent progression to AIDS. Estimated HIV infections in the United States by region in 2022. So when you look at how the United States is broken up, this is data from the CDC in their HIV surveillance supplemental report, which was published in 2024. And they're talking specifically about the population age 13 and older. So nearly half, so 49% of new HIV infections were in the South. So I think this is a really helpful graphic to look at depending on where you're currently working or practicing across the United States. And so these are, significant numbers, right, in terms of the regions and where you're seeing those new infection rates taking place. Another common bloodborne pathogen is hepatitis B virus, HBV. Hepatitis B is a viral infection that attacks the liver and can lead to chronic liver disease, liver failure, or liver cancer. It is more infectious than HIV and can survive outside the body for up to 7 days. HBV is transmitted through contact with infectious blood and body fluids, including through needle sticks, tattooing, piercing, sexual contact, and mother to infant transmission at birth. Vaccination is available and recommended to prevent HBV infection. Another is hepatitis C virus, otherwise known as HCV. Hepatitis C primarily affects the liver and can result in both acute and chronic infections. Chronic hepatitis C can lead to severe liver damage and complications. Transmission mainly occurs through direct blood to blood contact, often through sharing needles or other equipment to inject drugs. Unlike HBV, there is no vaccine for hepatitis C, but direct acting antiviral medications can cure the infection in many cases. So those are three that are common that create a risk for healthcare workers. And so when we think about that transmission, how and what are our risks in terms of those infections being transmitted either to another patient or to ourselves, the healthcare worker, the first we want to talk about is direct contact. And direct contact occurs when infectious blood or body fluids directly enter the bloodstream through an open wound, cut, or mucous membrane. Indirect contact means that transmission can also occur when contaminated surfaces or instruments come in contact with a susceptible individual. For example, if a healthcare worker touches a contaminated surface and then touches their face, they may be at risk. So, routes of exposure that we would commonly see first are needle sticks, right? So, one of the most common routes of exposure in healthcare settings is a needle stick. This occurs when a needle or sharp instrument accidentally punctures the skin, allowing infected blood to enter the bloodstream. We want to make sure that one prevention strategy is to always utilize safety engineered sharps devices to minimize this risk. Another route of exposure can be cuts and abrasions. Open wounds or broken skin can serve as entry points for pathogens. Healthcare workers should ensure that any cuts or abrasions are covered and properly protected while handling blood or body fluids. Eyes. So, blood or body fluids can splash into the eyes, leading to potential transmission. Protective eyewear should be worn in environments where there is a risk of exposure. And we'll talk about protective equipment here for all of these exposure risks as we move through the presentation. Mucous membranes. Exposures can occur through mucous membranes, such as those that are found in your mouth, your nose, or the genital areas. Activities that could lead to contamination of mucous membranes include handling contaminated instruments or when splashes occur. So, who's at risk? It's important to identify potential exposure risks in the workplace and those factors that contribute to that increased risk. So, in a environment, so think about where you're working. And I think, when we think about where we work as home care and hospice providers, the environment that we're working with is completely different. And we're going from place to place, home to home, where we don't have a lot of control over what we're walking into or the patients that we're caring for. That environment is really, managed by the patient and their families. And then we also might be having patients in facilities uh, that are staying there, like a hospice patient, for example. So, when we're thinking about where we're providing that care, it's important to assess areas where blood or other potentially infectious materials may be present. So, they're talking here about clinics, hospitals, labs, and home care settings. So, when you're in a patient's home, for example, where are those areas that there might be a greater risk for coming in contact with blood or body fluids, right? So, maybe there's an area in the kitchen where things are prepared, or there's an opportunity to have uh, you know um, different things out on counters or in the sinks, or dirty dishes or dirty forks, dirty cups, uh, trash baskets, things that are left around the home, the patient's bedroom area, wherever the patient is spending the most amount of time. But it's not even just looking at what potentially is a risk from the patient. It is also potentially all the other folks that are kind of coming in and out of that home setting, right? So the entire home is really a great risk for us. Bathrooms, as well, trash containers. So again, you're looking at, when you're doing that intake or that assessment, you really want to look at that entire environment in relation to the patient and the family members that are there, and what are the risks that are associated with what you're seeing and observing as you do those visits. And knowing, if you have dressing changes, if you have a patient who, is in the bathroom, if they have any wounds or open wounds, or dressing changes that need to be done, if they have any bleeding areas, if they're on anticoagulation therapy and have had some problems with bleeding, if they have a GI bleed or a history of a GI bleed, if they have, their own medical history. So have they had an exposure before to HIV, or are they being treated for HIV? Same thing with hepatitis B and hepatitis C. So again, the history, what you're seeing, what's happening with the patient, their clinical condition, their clinical problems, and you're kind of pulling that all together. The other is then, what is part of their medical treatment plan, and are they getting any injectable medications or um, have any sharps that are around that are a part of their treatment plan that you would want to be aware of and pay attention to as you're caring for that particular patient and their family. So, from an organizational perspective, one of the things that's important to understand or assess is, who are those team members that are going to be at greatest risk for coming in contact with blood and body fluid precautions. And so, administrators, directors, managers, organizational leaders really need to look at those specific job roles that are likely to involve occupational exposures, right? So the obvious ones are, healthcare workers, so any clinical care team members that are in direct contact with patients that would, increase risk to blood and body fluid precautions. So, MAs, physicians, home health aides, patient care technicians, um, any clinical support staff that are directly in contact with that patient. And a phlebotomist if you happen to have a traveling phlebotomy team to be able to go and do any type of home care treatment. Also, emergency responders, right? So, paramedics and EMTs, and then lab personnel handling those blood specimens. So, again, it's going to be unique to your organization, your individual care team members, and their roles. What are their associated roles, and what are the risks associated to the work that they're expected to do as a part of their job description? So, as a leader, it would be important to review tasks that may lead to direct exposure, such as wound care, injection administration, or preparing injections, or teaching family members how to give injections, or handling contaminated instruments, or handling contaminated dressing change supplies. Um, Having to help provide bathing to patients maybe who have open wounds or have problems with incontinence, bowel and bladder. So really, again, looking at the type of patient populations and the risks that are associated with the care that we're providing, and who are those team members that are providing that care. When we think about opportunities for prevention in terms of exposure, the first line is just really creating a barrier to yourself or your team member uh, to the exposure. So there's a couple of ways to think about it in terms of approaching this. First, we just want to mention sharps, right? So evaluating the use of sharps such as needles and scalpels and any other sharp materials that might be used as a part of procedures for the patient. And what does that disposal look like? How are they being disposed of, right? And then the adequacy of the personal protective equipment, the PPE that's available, accessible, and provided to employees and is used in the correct way. That staff know what to do with sharps and how to protect themselves from needle injuries. And then what do they do in terms of using PPE and are they using it appropriately, have access to it, and are using it on a regular basis. So, in terms of thinking about appropriate policies and procedures within an organization, one opportunity that we have every year as we do these annual trainings is to step back and do an assessment of what we currently have in our organization. So, what are the current protocols that we have for handling blood and other infectious fluids that the staff person would come in contact with? And then part of that policy review is, what are the recommended procedures for cleaning and disinfecting? Um, should there be, a blood spill or visible blood or suspected blood or body fluids in a particular area where we're providing care? And then what to do in terms of the safe handling and disposal of waste for items that we have are taking out of a patient's home or a clinical care setting. And then the other part of your policy and procedure should identify practices that could increase the risk of exposure, such as improper needle disposal or lack of hand hygiene, right? So it starts with a good policy. Are we following the appropriate infection control policy or having effective procedures that are going to protect our staff, right? And then how are we assuring, one, that our staff know what those policies and procedures are, can access them, and receive routine training on what those procedures should be. So, factors that could contribute to increased risk, number one, is training, people not knowing what the policy is. They, for example, they did have a needle stick. What do they do if they have a needle stick? Who should they call? What happens when there is a needle stick? What is the relationship with the provider that's going to evaluate them? Who gets when does that occur? What happens after hours? What happens on the weekend? It's very clear. There should be a very clear set of guidelines that are outlined in your procedure in terms of doing that. And then training. What is included in that assessment when they walk into a patient's home? um, what uh, what are considered to be the high risk areas based on certain conditions? What do they do if they have materials that have waste on them? What is the direction that is given to provide the patient and their families about what they would do with these types of contaminated materials? Like, say, for example, after a wound care procedure, or if the patient is having problems at home, like I said, with continence or I'm sorry, incontinence. And what do they do with all of the blue pads that might be saturated or the bedding that's there? Again, it's not only training our staff about what our internal procedures are, but also what are we doing to prepare our patients and their families, which is also going to minimize the exposure to themselves as well as to our staff when they're going out to do a visit. The second here is listed as equipment and engineering controls. So the lack of available or accessible safety devices. So, for example, safety engineered needles, sharps disposal containers, these can heighten exposure risk if you don't have access to them, or you don't know where to get them, or you don't properly help the patient's family process the order of what's needed in the plan of care related to the types of equipment that the patient would need. That is also going to contribute to a delay or a gap that could create a situation where there is a risk associated with the availability of what people have in front of them. Also, poorly maintained or defective equipment may also pose risks, so regular inspection and maintenance are crucial. Environmental factors, so assessing for high stress job environments. And so, what's listed here is emergency rooms and critical care, obviously, are high risk and stressful job environments because in those types of environments, it may lead to rush procedures that increase the risk of accidents or missteps in whatever that policy is or that procedure is. That's true for home care as well. When you think about it, can be very stressful when you walk into somebody else's home and you don't know the lay of the land or the environment, and you're uncertain about what you're seeing or what's happened or what's contributing to maybe what you're seeing, right? So the environment and that ambiguity or that unknown, walking into that unknown, can also be very stressful and lead to us cutting corners or not being certain about how to address the situation, or what to do in terms of a safety mechanism to prevent ourselves from getting exposed to something like that. And same thing for the families on the other side of that. If the care that they're providing for their family member is stressful and challenging and difficult, they also may not follow what's recommended in terms of cleaning and properly preparing certain environments. So we want to just make sure that we're cognizant of that or aware of how the environment and how stressful our jobs can be, can lead to opportunities for things to get forgotten or missed or completely not even being aware of something that we need to do. The other, and this is very true in um, home care situations, is crowded or poorly organized workspaces can also lead to decreased attention to safety protocols. So we've all been there, right? You're trying to figure out where you're going to put your bag, where you're going to, you know, get your hands washed, where are you going to, the patient might be here and it's he or she may not be in the proper positioning for what you need to do. I mean, it's just a total um, it's not like you're walking into an acute care setting into a patient room and you have a bedside table and a side table and you can roll in another table. You don't know, right? In many cases, or you're trying to clear patients clutter, family clutter as well, right? And so that can also lead to contamination based on opportunities for missing the right way to approach something because we don't have the right room. Others are human factors, right? So when you think about, fatigue, being distracted, or being complacent, can also cause employees to overlook safety protocols. So if you're getting calls on your phone or texts on your phone about the next patient visit, or maybe you're on your cell phone because you're getting a call because you're getting a patient add-on. Maybe you didn't sleep well last night, you're not feeling well, so fatigue can also be a factor, right? All of those personal issues or those things that are part of our jobs that are interrupting us can lead to errors and where we're not necessarily following the appropriate safety protocol that our organization has laid out. So it's important to be aware of that, right? Also, behavioral practices such as repositioning contaminated items without proper sanitation also increase the risk of exposure. So, again, thinking about our placement and moving things around and the steps that we might be taking to, I'm going to use inserting a Foley here as an example, and you maybe go in and reach and you didn't have a sterile glove on or something, it's real easy to contaminate uh, a sterile field, and it is also really easy to contaminate and increase our risk of exposure to blood and body fluids by not following a proper procedure as we're going through these things. The other is inconsistent policies. So we started off talking about that. So a lack of uniformity in safety policies across departments or shifts can lead to gaps in protection and safety awareness. So a good, solid policy with a clear procedure that is communicated and accessible to staff is very important. And then clear and consistent communication of safety measures and expectations is essential. So it's really helpful, I think, to walk through with teams and listening as a team member, um, situations or events that took place so that you can walk through and learn from areas that might have been a challenge and an error that maybe that occurred or a problem that occurred. So that debriefing is very important to be able to see, what could we do to assure that our policies are consistent. I know one of the challenges that I have observed in across several organizations is that there may be very well written policies, but they are maybe not known down to the staff who are, you know, forward facing with patients on the day to day. And, we maybe orient and train people to those policies in orientation, but it is established in the evidence that ongoing practice and evaluation and feedback through preceptors or competency assessment on supervisory visits is a really good opportunity to be able to provide direct feedback in the moment, and then also coaching and communicating what those policies are and where they can be found. And then the last here is compliance with safety standards. So just a reminder that organizations that do not adhere to OSHA guidelines or fail to complete necessary risk assessments may expose employees to higher risk. So one of the requirements at that organizational level are those assessments to see how are we doing, right? And we do this, as a part of our accreditation process, right? That's one of the things that we look at in terms of patient safety and employee safety and how we're working, as organizations to assure that we have systems in place that are effective and help us maintain the safest environment for care that we're providing. All right. So we talked a little bit about some of the standards. We're going to talk now about OSHA and bloodborne pathogens a little bit more, employer responsibilities, and employee rights. Okay, so let's talk about the employer's responsibilities. First is making sure that there is an exposure control plan. We've already talked about policies and procedures, about what to do. Now we're talking about exposure control plans. So, what is an exposure control plan? It is a plan that is going to identify what happens if a staff person is exposed to blood and body fluids and has a risk for contracting an exposure to one of the infections that we've talked about. And so your exposure control plan should identify what and who they need to call, and then what will happen sequentially after there. Where will they be sent? What will the follow up plan be? And how is all of that documented? So that plan is very important um, to have completed and is always reviewed and updated at least once a year or annually, or whenever there's the opportunity to make changes because maybe tasks have changed or contractual relationships with occupational health providers may have changed or responsibilities have changed. So, uh, it's important to make sure that it's current and updated and reviewed and updated routinely, and at the very least, at least once a year. And then that plan also has to be accessible to employees and known, right? It's very hard to be the office manager or the staff person and have somebody that has a exposure, and then everybody's trying to figure it out at the time. It's very stressful. It's very challenging, and and if it happens to be after hours or on the weekend, that also further complicates things where people are trying to figure things out. So, again, what happens? And if you provide 7 day a week coverage as well as 24-hour day availability to patients where there's risks of these things maybe happening in the off hours, those there needs to be a plan for what to do in those cases as well. The other is, again, we talked about this already, identifying those job classifications and tasks. So, where are those, what are those jobs, or who are those team members or team member roles where occupational exposures to bloodborne pathogens are uh, more likely or they might occur, right? So, you may have employees within your organization that go through training, but they may not be forward facing with patients, and so their exposure risk is very minimal. So their job is going to be different, and their um, knowledge or their competency or their skill set that you need to evaluate is going to be different than those that are forward facing with patients where there's risks associated with that. And then again, analyzing those work processes to determine those potential exposure risks. And so this is a good opportunity again to use those supervisory visits to be able to evaluate not only staff understanding of what the procedures are, but also what are some of the things that are out there that are happening that as a leader within an organization, you can bring back to, incorporate into the policies or updates, depending on what you're seeing and observing, and staff are maybe have questions about or don't demonstrate confidence in what they need to do, right? So, again, the goal here is to assure that we are providing the best information based on the evidence that's accessible and available to staff so that they know what to do if should an exposure take place. Um, and preventing exposure, sorry. The other is post exposure evaluation and follow up. So, establishing procedures for evaluating and following up on exposure incidents. So, not only what happens in the immediate, what happens if there is an exposure, then what is the follow up related to that exposure. And part of that is that medical evaluation and treatment as necessary, which may include post exposure prophylaxis, depending on the organizational policy and the assessment of the provider who's providing that medical evaluation and their determination as to what's needed. And then it is also important to know that this is all confidential. So when you have an event that takes place within an organization, you also have to have a process in place to assure that only the people that need to know this information know it. Otherwise, it is again a confidential. And you want to breach HIPAA by sharing information out of context of what needs to be shared and how and where, because we are now stepping into medical treatment of staff, and we don't want that to be open knowledge of results and what was done and those kinds of things. Communication hazards. So using labels and signs to communicate biohazard warnings and implementing color coding systems for containers that hold blood or otherwise potentially infected materials. So again, what is your organizational policy to identify and label, where are those labels available, what's recommended, how do you organize that? And again, we're all working in different environments. Some of us may be spending more time in facilities, some of us may be spending more time in patient homes, some of us may be working multiple facilities to see patients. So again, it's knowing those facility policies as well, and then where how do we fold that into their policies? What has our policy match with their policy, and how do we integrate those steps so there's no confusion in should something like that happen? And then how do we identify those potential hazards that we might be coming in contact with, that we're going to label, and what those labels look like? Training and information. So we've talked a little bit about that already. So again, conducting initial and annual training for employees who might be exposed to bloodborne pathogens. So clearly, any new hire in onboarding should be required to attend training around bloodborne pathogen exposure, and then a refresher annually for employees who might be, knowing what to do in terms of if they are exposed and how to handle that. You want to make sure the training is comprehensive. It covers the risks, prevention strategies, and procedures in the event of an exposure. So again, knowing what your policy is. So you could have a staff view a high level program that's providing general information like we're talking about today, but then how do you bring that down to the details of folding in your policies? And this is a really good example of, or a good way to use, staff meeting time and bring in case studies or patient examples have people actively participate in dialogue and discussion and ask and answer questions. Also, record keeping. So you need to have a process to accurately maintain records of training sessions, also exposure incidents and medical evaluations. If you are using QAPIplus software or HR Plus, there are a lot of opportunities within that software to integrate that documentation of attendance and incident reporting, and both from the clinical side as well as the HR record keeping side. And then again, these records are confidential and stored as per your organization's OSHA requirements. So what OSHA is requiring should be a part of your policy, and how you handle that is all documented in your policies. All right, so one thing to write down as a um, self assessment moving forward, and this should be whoever's completing this call or this training, from the space of your own role. What is your agency exposure control plan? Where do you find it? When was it last updated? How do you talk about your exposure control plan within your organization? Do you know what to do if you have a needle stick out in the field? Do you know what to do if you have come in contact with blood and body fluid for blood and body fluids in the home or in a facility, um, as you're doing your clinical care? So that's a to do as you leave this training, is to go back and find out what that is and ask about it if you don't know. Where do you find it? And then reading it, reviewing it, and making sure you understand it. And that it's current, right? That it's not something that was written a couple of years ago and hasn't been updated recently. So you want to make sure that you're doing that. All right. So let's think about a couple of standards around bloodborne pathogens. So we already know that blood and body fluid standards apply to when workers have occupational exposure to human blood or other potentially infectious materials, as defined in the paragraphs A and B of the BPP standard. We'll go over that in a minute, and requires the use of universal precautions to prevent contact with these materials. And adhering to the standard and transmission based precautions in healthcare settings is recommended by the CDC and protects workers from a wider range of infectious disease hazards than the BPP standard. So, in terms of preventative measures, the recommendation is that you have safe work practices to minimize your exposure, right? So, again, thinking about your environment and access to equipment and policies and procedures that are going to guide you. You want to have that foundation, right? That's going to prevent um, your minimize your exposures, but then also know what to do if you should be exposed. Always use appropriate personal protective equipment. So that would include, it's called PPE, so gloves, masks, goggles, and gowns when dealing with blood or body fluids. You may need shoe covers, again, depending on the patient, but these are the ones that are recommended as a part of PPE. Implementing effective engineering controls such as safe disposal containers to minimize exposure risks. So, what are those? Where are those? How do you get them and how do you access them? Or how do your patients order them or receive them so that they have them available in their home? Or where are they if you're in a facility? Regular training on safe work practices and the importance of reporting exposures promptly. So this is a big piece of this as well, is that if you are forward facing with patients and you have an exposure or you have a needle stick or you're simply not certain, you want to be able to contact your next level person. So is it the care manager? Is it the practice manager, the team manager? You want to be able to report it promptly right away, not go home and think about it and maybe tell about it the next day. You want to report it immediately. That is critical. So, how do you do that? What is your reporting procedure? Do you call your manager? Is there, what is that process within your organization so that you can start that process immediately and not waiting? Universal precautions were originally recommended by the CDC in the 1980s, and they were introduced as an approach to infection control to protect workers from HIV and HBV, so hepatitis B, and other bloodborne pathogens in human blood and certain other body fluids, regardless of the patient's infection status. So it was universal. You were going to treat everybody the same. Universal precautions, are an approach to infection control in which all human blood and certain human body fluids are treated as if they are known to be infectious. So, although the BPP standard incorporates universal precautions, the infection control community no longer just uses universal precautions alone, right? We're going to focus on that BPP standard. And then transmission based precautions, otherwise known as TBP, are contact, droplet, and airborne transmissible diseases that augment standard precautions with additional controls to interrupt that route of transmission that may not be completely interrupted using standard precautions alone, right? So, thinking about those respiratory exposures, we might have to do additional measures like fit testing for mask types, right? Depending on what we're seeing with our patients and what the clinical condition of the patient is. So the different types of TBP are applied based on what is known or suspected about a patient's infection. So they're building on each other, right, as we move forward. So universal precautions were kind of all encompassing, treat everybody the same. They've since moved incorporated universal precautions, but are more specific about standard precautions, and then are incorporating these transmission-based precautions around specific diseases or viruses, depending about how they're spread, and are in addition to standard precautions. And we'll go through these a little bit more as we go forward. So, standard precautions were introduced in 1996 by the CDC, and they added additional infection prevention elements to universal precautions in order to protect healthcare workers not only from pathogens in human blood and certain other body fluids, but also pathogens present in body fluids to which universal precautions didn't apply. So, standard precautions include hand hygiene, so hand washing, the use of certain types of PPE based on the anticipated exposure, what you think you'll come in contact with, safe injection practices, and safe management of contaminated equipment and other items in the patient environment. So, standard precautions are applied to all patients, even when they are not known or suspected to be infectious. So, we treat, again, everybody the same, making sure that we are practicing good hand hygiene. We're using certain types of PPE based on what we think we're going to be exposed to. We're really focusing on safe injection practice, and then what do we do with the contaminated equipment and other items in the patient environment. So standard precautions in home care and hospice. First is hand washing, right? So we want to focus on performing hand washing with soap and water or using alcohol based hand sanitizers before and after patient contact and after handling potentially contaminated items and after removing gloves. Personal protective equipment. We want to use appropriate PPE such as gloves, gowns, masks, and eye protection based on the potential for exposure. Gloves when handling blood, body fluids, or contaminated items. Gowns when there is a risk of splashes or contaminated clothing. And masks and eye protection when we're doing procedures where blood or body fluids may splash. All right, so continuing, safe needle handling and disposal is also part of that standard precautions approach. So, utilizing safety engineered needles when possible and ensuring that sharps containers are readily available in patients' homes for the proper disposal of needles and other sharp instruments. And then handling blood and body fluids, treating all blood and body fluids as potentially infectious, and using absorbent materials and protective coverings to prevent spills during procedures. Environmental cleaning and disinfection, so regularly cleaning and disinfecting surfaces that may become contaminated with blood or body fluids. So, again, looking at your organizational policy for what that recommendation is, what the ratios are, and then what you're training or educating your patients on in terms of how to disinfect, those surfaces, and then the types of disinfectants that are recommended for cleaning reusable equipment and instruments. Patient care equipment management. So, again, ensuring that reusable medical equipment is cleaned, disinfected, or sterilized according to protocols before use on another patient. So, again, your organizational policy should identify what those cleaning procedures look like, what the solution or recommended products are that you would be teaching or educating patients, and then also including in terms of staff, if staff are involved in cleaning any of that equipment. And then again, patient education around sharing personal care items, as example, razors that would come in contact with blood. So again, looking at your patient education materials and how or training, and how does that what does that look like? What are those materials and resources that are available to patients to be able to help support them? uh, Patient education is really central to being able to help not only have a safer environment for us to enter into, but also safer for them as well. So we want to make sure that they're included in infection prevention measures, including the importance of hand hygiene and safe disposal of sharps. So what are they going to be doing in terms of how they're caring for themselves, or maybe they're caring for family members within the home? That hand washing is really important. Do they need PPE as well? What is that protective equipment, or PPE that they should have as well? And then what do they do to kind of clean that environment? You also want to have a policy around incident reporting and follow up. So remember, we talked about making sure that if you have an exposure, you are reporting it to whoever your policy identifies. So in my organizations, it's always been my upline manager. That's who I'm contacting and letting them know. I might be writing it as an incident report, but I'm also calling to let them know that this is what, and so that we can activate that exposure follow up plan pretty quickly so that we don't have this delay in being able to be evaluated and potentially treated if needed. We also want to make sure that the caregivers that are taking care of the patient know how to, report as well, right? So if they have an exposure, a needle stick, they we need to have in our materials, what do we do to guide them? What does that evaluation look like for them and treatment exposure that would potentially occur that we would be guiding them to? So it's not only ourselves, but other caregivers that are working with those patients. If our patients are in a facility, being aware of what those policies are in the facility as well. What is their incident reporting procedure? You're going to likely report in your own organization, but do they need to have that information as well? And again, the management and the leadership should be paving the way for these collaborative policies to be shared and known and aware of. The other is a vaccination program. So it is a standard to have a vaccination program for hepatitis B among staff in the healthcare field. That would include home care staff, and ensure that we have a process to ensure that they have access to vaccination. So again, vaccines are an opportunity to prevent. Should there an exposure happen, you want to have that vaccine on board. And as we talked about earlier, there isn't a vaccine for hepatitis C, but there is for hepatitis B. There is too, but for hepatitis A, but we're talking specifically about bloodborne pathogens here as well. So you want to make sure that you have that available to you, and staff are aware of it. And it may be mandatory in many organizations. It is mandatory, but it's been very effective at preventing um, hepatitis B among healthcare workers. All right, let's talk about safety related to sharps and a disposal plan. So when we think about sharps, and the background of that is, shorter hospital stays and improvement in technology has led to more procedures in the home care setting, increasing the use of sharps in the home. Think a lot about wound debridement and some of the wound care services that are provided as well. So when we're thinking about the acuity level of the patients that we're seeing in that home care setting, they have more things that are being done, things that we would have typically seen in the acute care setting before. And so we have to be more prepared to be able to handle all these additional needs of our patients, and be confident in the way that we're providing care to them in the safest way is protecting them as well as protecting ourselves. So the World Health Organization estimates that 1 in 10 healthcare workers worldwide sustain a sharp injury every year. So that's a pretty significant strategy. And they don't break that down into work location, right? So 1 in 10 healthcare workers around the world. And as a result, that puts us all at risk of sharps injuries and bloodborne pathogen exposures, of which hepatitis B, hepatitis C, and HIV are the most concerning. That we, want to make sure that we are, preventing our risks. So sharps disposal, along with hand washing, is also really kind of a hallmark opportunity for us. We want to make sure that used needles and other sharps, we are aware are dangerous to people and pets, if not disposed of safely, because they can injure people and spread infections that cause serious health conditions. Safe sharps disposal is important whether you're at home, at work, at school, traveling, or in other public places such as hotels, parks, and restaurants. You want to never have patients place loose needles, or you yourself, if you're administering medication with a needle, loose needles and other sharps, those that are not placed in a sharps disposal container, in the household or public trash cans or recycling bins, and never flush them down the toilet. This puts trash and sewage workers, janitors, housekeepers, and household members and children at risk of being harmed. Also, pets. We don't often think about pets, but when we're in our home, in a patient's home, pet owners who use needles to give medicine to themselves and to their pets should also follow the same sharps disposal guidelines for humans, right? So, sharps are a danger, and we want to make sure that we are evaluating that home environment and our patients and what treatment plan they're on, so that we have an effective plan for sharps management. So, proper storage of sharps can be considered needles, scalpels, broken glass, should be stored in puncture proof, leak proof containers that are labeled with a biohazard symbol. You should, in terms of waste, you should separate healthcare waste into different categories, such as general, infectious, and radioactive waste. That's probably in an acute care setting or a facility as opposed to the home care setting, to ensure proper handling and disposal. You want to make sure that you're handling it properly. So, wearing personal protective equipment like gloves, gowns, and face shields when handling sharps and healthcare waste to minimize the risk of exposure. And then disposing of sharps and healthcare waste in designated color coded containers that are collected and transported by authorized personnel to appropriate treatment and disposal facilities. So, this disposal procedure is going to be specific to your organization and the community with where your organization provides care, right? So in some communities, we're transporting sharps and hazardous waste maybe to the hospital, maybe to pharmacies. It really sort of depends. Maybe the health department, sort of depends, right? So that should also be addressed within your policy. All states have guidelines around what that disposal should look like. And it's challenging, right? And patients want to need to know this as well, and their families need to know this as well. So that should be a part of your policy around, um, providing safe care to avoid risks for exposure. So, assuring or adhering to these guidelines for safe handling and disposal of sharps and healthcare waste is crucial to protect healthcare workers, patients, and the environment from potential hazards, and to ensure compliance with relevant regulations. So we talked about syringes, lancets, sharps in puncture-proof, leak-proof sharps containers. These should be placed close to the work area and replaced when they're three-quarters full. Never let them go up to the top. I know we've probably all worked in places where it's just right up to the top and you can't close it. So we want to avoid having those containers be full all the way to the top. The other is, again, segregating the waste. So, any wet waste like bandages, gauze, and gloves from the general waste, you don't want to just throw those into the trash if they're contaminated. So, place them in a leak-proof, color-coded container, and dispose of it according to your organization's medical waste management protocol. So, again, where you access those containers, those bags. I know we use red bags. What is your policy around that, and then how does it get labeled and taken out of the patient's home if needed? Recapping needles. We never want to recap, bend, or break used needles. We want to dispose of them directly into the sharps container immediately after use. So that's why you want to have that sharps container close by. Avoid passing sharps directly from hand to hand, using a tray or other container to transfer sharps between team members, and keep sharps containers within easy reach to minimize the risk of needle stick injuries. And then do not keep used sharps on the work surface or in your pocket. We want to dispose of them in the container immediately after to prevent accidental needle stick injuries. So we've talked several times already about education and training. So healthcare workers should receive thorough training in sharp safety protocols, including proper handling, disposal, and the use of safety devices. This, I can't underestimate this enough. If you have safety needles and the types or the various options that you might have for your patients, you want to be familiar with them and you want to have the opportunity to practice with them so that you feel confident in how to use them. You also want to make sure that patients and their family members who might be, in contact with those sharps as well, if they're administering any medications, they know what to do with them. Also, we care for a lot of patients who are monitoring their blood sugar. So any of the sharps that are associated with that, what are they supposed to be doing with that? Where do they keep those? Any home generated sharps like those for self injections or maybe continuous glucose meters or monitors or pump injection site injection setups, infusion sites. We want to make sure that we are asking them or showing them what to do and how to use what container they should be putting those materials in and then throwing them out. And then having as a part of your patient packet information on community disposal options such as drop off locations or mail back programs like we talked about. And oftentimes those can be found information about your local community on your health department's websites or hospital websites, health system websites. OSHA also has a policy around or recommendations around safer medical devices. Employers are required to consider and use safer medical devices wherever possible. These devices include those that are needleless or have built in protection to guard workers against contact with contaminated sharps. So employers must ask non-managerial patient care workers who could be exposed to contaminated sharps injuries for their input in identifying, evaluating, and selecting effective work practice and engineering controls, which would include safer medical devices. So again, talking about and collaborating on what would be the best devices to be using within our organization, the ones that the people who are using them on a regular basis, are they working for me, right? So it's not just higher up people that are making those decisions, but is it going to work for me in the field? Am I able to use this? Is it not only cost effective, but also reasonably easy to utilize so that I feel good about uh, incorporating it into my practice. And then the employer also has to have a documentation that sort of outlines really, their considerations in terms of why they selected the device they did or implemented these devices as their part of their selection process and how they went about getting input from the staff. And then that's also, as a part of that exposure control plan. So there's documentation that shows that the organization did their due diligence about getting feedback as to the safest devices that are there. This is a nice graphic, and I've provided some graphics in your training site for you as well, some handouts that can be printed and posted within your organization on some of the things that we've talked about today. But 5 ways to prevent sharps and needle stick injuries, and this is specifically from OSHA. So plan safe handling and disposal before any procedure. So know what you're going to do right before you get started, not be looking in the middle of everything. Use safe and effective needle alternatives when available. Activate the device's safety features. Immediately dispose of contaminated needles in OSHA compliant sharps containers and complete bloodborne pathogens training. So cleaning and disinfection, this is another category. So using appropriate cleaning supplies, utilize EPA registered disinfectants and follow manufacturer's instructions for safe and effective use. So your organizational guidelines should have those identified. I know in patient education materials, they are often listed to educate patients and their families. These are the supplies to be able to have for good disinfection and cleaning within your home. So make sure that's in there. You want to have a process where frequently touched surfaces are disinfected, particularly high touch areas like doorknobs, light switches, countertops, and equipment regularly. And this is likely not us as healthcare providers that are doing these things, but we want to make sure that we are educating our patients and their families to do that. Cell phones, devices as well. Give our patients tablets. So, what can they wipe off the surface of their tablet with? Remote controls, all those high touch things that are likely to have contaminants sitting on the surface. If you remember, hepatitis B hangs around for a while on surfaces, so we want to minimize our exposure with thorough cleaning. Proper hand washing. In last month's module, we went over hand washing specifically. You want to make sure that you're encouraging yourself and your staff and your patients and their family members or caregivers to wash their hands often with soap and water for at least 20 seconds. So, again, before contact with the patient, after you've taken off, put your gloves on, take your gloves off, wash your hands again, and you're doing it for 20 seconds. You can also use an antibacterial solution as well, hand gel, hand sanitizer. But you want to make sure that we're hand washing a lot, even when you're putting your gloves on and taking them off. You want to make sure you're washing your hands after. Sometimes we have that false sense of security when we've been wearing gloves. Maintaining a clean environment, so regularly clean and disinfect the entire home care or home office setting, but also home setting where the patient is, including floors, walls, and furniture. I know we have no control over patients' homes, but this is a, something that we can work with the family on in terms of, if they know we're coming in for a visit or the home health aides coming in for a visit, what can we do to teach them to have that environment ready for us when we're coming in, if possible, if they're able to do that. Waste disposal, so safely dispose of used cleaning materials and any contaminated items in designated biohazard containers. So, what does the family do? What should they have there as well? And then, how do we fold that into our patient education material? Then we've talked about training as well. So, cleaning and disinfection should be part of our training plan. We've already talked about sharps and being in a leak-proof container and labeled as sharps waste, and then dispose of those containers through licensed medical waste disposal services. So again, looking at what your community resources are and providing those to your patients. And then anything that's blood-soaked, bandages, gloves that have you know uh, blood or body fluids on them, dressings that you might be removing as you're changing or cleaning a wound. You want to place those in leak-proof, color-coded red bags or containers, and then seal those bags and label as infectious waste and dispose of them through the policies or the procedures you have for your organization. You want to just dispose of them through a licensed medical waste disposal service. Considerations in home care. One is around wound care management, so home health nurses changing the dressing on a chronic wound. During the procedure, blood may leak from the wound, and if the nurse isn't wearing gloves, they could be exposed to the contaminated fluid. So, again, thinking about anytime you're having contact with that patient, thinking about standard precautions and what you're doing and what you're coming in contact with. And, you know, um, it's easy enough to just want to try to go touch a patient with your bare hands, but putting gloves on is a best practice. IV therapy. Here's a caregiver administering medication through an IV line. If the IV site is accidentally disturbed, like maybe the patient moves unexpectedly, blood could be, leak out from that, and then that's also another risk of exposure. And then emergency situations. In the event of a fall or an injury, a caregiver may need to provide first aid to a patient with a bleeding wound while waiting for emergency services. There's a high risk of exposure if the caregiver doesn't have appropriate PPE during this unexpected event. So, again, as a part of your supply order for your patients, what will they need at home? Should they have, getting a box of gloves, or are we directing them to go out and buy a box of gloves, to have available, or do we provide them a box of gloves? Again, it's not even just us, it's also those caregivers that are supporting our patients. We want to be able to help prevent them as well. And emergencies will come up, right? And so We want to be able to let them know, if you're coming in contact with blood or you see any bleeding, or body fluids, you want to make sure that you have um, gloves on and maybe a gown if needed, but gloves at the very least. Handling contaminated laundry, so caregivers may need to assist patients with incontinence issues. Handling soiled linens or clothing that contains blood or other body fluids can lead to exposure if proper protective measures aren't taken. In terms of fecal incontinence, a patient with fecal incontinence may need assistance with hygiene. So, if blood is present in the stool due to an underlying condition, caregivers may inadvertently come into contact with it, leading to potential exposure. Taking out Foley catheters. When removing a catheter, there may be bleeding or discharge that can pose risks if caregivers are not wearing gloves or taking proper precautions to contain any spills. So, again, thinking about that laundry, the clothing, if they're, incontinent, if we are removing a Foley catheter, all things that maybe, some are obvious, right? Fecal incontinence, people wear gloves, but what are we going to do when we're, talking about the laundry and or they are removing the laundry? Where do they put it? What do they do with it? How do they clean it? What are they wearing? Are they wearing gloves? Should they be wearing gloves while they're removing that those materials so that they're not coming in contact with unknown body fluids? So some are more obvious, others are hidden, right? And so we want to be able to help protect them as well. Personal care items, um, we want to make sure that they're not using the same grooming items because there's a risk of cross contamination. Also, feeding and oral care in patients with bleeding disorders like maybe hemophilia. Maybe they're on blood thinners. They might encounter blood during oral care or feeding assistance. So that's another, place to, if they're feeding, to wear gloves. Assisting with self-administered injections. So again, that might be an opportunity as well. Plus, what do they do with that needle or that lancet if it happens to be a blood sugar, or like I talked about earlier, diabetic pump supplies or CGMs, anything with sharps that come in contact. What do they do with that? And wearing gloves when they're, putting, helping with those types of procedures. And then live procedures. A caregiver might assist during maybe a wound debridement or care for a dialysis patient where blood and body fluids are present. So again, there's a significant risk of exposure if protective measures aren't followed. So again, considering them a part of that care team, and how do we make sure they have what they need to be able to protect themselves? And these are some examples. Um, and they're not mutually, exclusive. There are probably other scenarios where you're coming in contact with patients as well that you might want to wear those gloves. All right, so we're going to talk now about the importance of an exposure control plan. Components of an exposure control plan include the exposure determination, the implementation of methods of compliance, hepatitis B vaccination, post-exposure evaluation and follow-up, record keeping, annual review and update, and then staff training, initial and refreshers. So, know your organizational policies. So when you think about what to do in an exposure, if you're accidentally stuck by another person's used needle or other sharp, you want to right away wash the exposed area with water and soap, or use a skin disinfectant with like an antiseptic, such as rubbing alcohol or hand sanitizer. Contact your supervisor, and then based on your organizational policy, you'll be directed where to go. You're going to need likely medical attention. And it may be your policy may be that says call your in your local hospital. Your supervisor may also, or your organizational policy may be working with an occupational health clinic or site that is where you might be directed to go. So it could be one or all of those environments, but it does require medical attention, and that's why something happens, you want to report it immediately. You don't want to wait. Wash the area, and then go ahead and contact your supervisor. So here's an example in a case study. In a major urban area, a home care agency provides skilled nursing and personal care services to patients in their homes. The agency employs a diverse staff of nurses and nursing assistants who frequently interact with patients requiring wound care, IV therapy, and assistance with ADLs. So one afternoon, a nursing assistant named Sarah is assigned to care for Mr. Thompson, a patient recovering from surgery who has a chronic wound that requires daily dressing changes. During the dressing change, Mr. Thompson accidentally bumps his arm against the edge of the bed, causing the dressing to become saturated with blood. As Sarah attempts to clean the area and replace the dressing, she inadvertently pricks her finger with a used, improperly disposed of needle that has fallen from the nightstand during the patient's previous care session. The needle had not been disposed of in a sharps container, which is a violation of safety protocols. Sarah immediately washes the area with soap and water and reports the incident to her supervisor. So the actions taken, the immediate medical evaluation. Sarah is instructed to seek immediate medical evaluation. She visits the local clinic where she's directed to go by her organizational policy, and they do baseline blood tests to determine her health status before that exposure, right? So you want to get her baseline right away. Then post exposure management, based on the nature of the exposure, and in this case, Sarah's going to receive guidance related to post exposure prophylaxis, prophylaxis, so PEP for potential HIV exposure, and is tested for hepatitis B and C. So she's actually going to get treatment. Not every person will be recommended to have post exposure prophylactic uh, through medications. It depends again on the situation and the patient and um, the type of exposure, like what happened with her. And here she has a needle stick, so they're going to go ahead and do the PEP as a preventative. And then the agency, so the manager, is going to conduct an investigation to understand how the incident occurred. And they discovered that the home care staff had not been adequately trained on the importance of safe needle disposal and the specific procedures for handling sharps in a home care environment. So you are in a role within your organization where you are looking at um, safety issues that happen within a clinical practice or a clinical team. One of the things that needs to happen in addition to dealing with the incident in the immediate, and how do you care for the patient, which is the staff member in this case, and is there anything that you need to do with the patient and the family as well, any follow up there. But then also as a part of your investigation, you want to do a root cause analysis. What really happened here? Why did this happen? Use the 5 whys or the RCA tool to be able to evaluate so that you can figure out, where your opportunity is in terms of making changes so that it doesn't happen again. And in this case, it was around staff training and knowledge around safe needle disposal. So they're going to activate a plan here. So this is a PIP, a performance improvement opportunity, to be able to document what is happening through. You can do it in QAPIplus related to those incidents, and then what you're going to do and what your follow up is going to be. And it also, I think, it gives you the opportunity to really look at trends, right? Are you seeing the same kinds of safety issues that are happening, so that it gives you a more of an opportunity to really dissect that and see if we do have a problem here. If it's one incident, it's different than if you see patterns of incidents as well, but you do want to establish a root cause for each of them. The other thing in relation to this is then reviewing the policies and if there are any revisions that need to happen. And in this case, they make the following changes: mandatory retraining for all staff on bloodborne pathogen exposure and the importance of using sharps, containers, and proper procedures for handling needles, regular audits of home care visits to ensure compliance with safety protocols, and providing additional sharps containers for patients' homes to encourage proper disposal practices. And then follow up and support. Sarah is monitored for any potential infections for a period of 6 months. So that's based on the healthcare provider's evaluation and treatment plan, during which she receives support and counseling regarding her situation. Regular follow up appointments are made to ensure her mental and physical well being, right? So it's emotional uh, to go through something like this if you've had a needle stick and you are worried, you're scared, and so we want to be able to take care of that whole person and make sure that they feel as supported as possible. So key points, making sure that we're always using appropriate personal protective equipment, such as gloves, masks, goggles, and gowns when dealing with blood or body fluids, or the potential of blood or body fluids, right? They don't have to be visible there for you. I think about home health aides as we're providing physical care to our patients. Wear those gloves because you don't know what you're exposing yourself to. Implementing effective engineering controls such as safe disposal containers to minimize exposure risks, having or participating in regular training on safe work practices and the importance of reporting exposures promptly, and then making sure that you understand the modes of transmission and implementing preventative measures. Really, the key here is preventing an exposure to begin with and working with staff to significantly reduce their exposure by looking at the risks that could be available in the environment and being more cautious, as you're approaching the care of those patients as you're moving forward. So, in conclusion, in home care and hospice settings, awareness of bloodborne pathogens and adherence to standard precautions are critical to protecting staff and patients and their caregivers or their family members. And implementing these practices can significantly reduce the risk of exposure to bloodborne pathogens and promoting a safe and healthy environment. Thank you very much.